and welcome to the latest edition of Phoenix Children's Live. I am Erica Sturwald. I'm a brand manager here at Phoenix Children's Hospital in our Marketing and Communications Department. It's my first time hosting today, so go easy, but I'm here with two phenomenal experts from a brand new program to the Valley and to the state of Arizona called Arizona Mother-Baby Care. And these two lovely ladies here are here to explain the program to expectant mothers and mothers with kind of high-risk pregnancies and high-risk young babies at home to kind of just talk about what the program means to those mothers in the Valley. So just a quick background before we get into introductions is this program is a collaboration between our very own Phoenix Children's Care Network as well as the Arizona Care Network. So it brings together a number of medical systems and hospitals in the area. So they're here to talk more about that. So here we have Jessica Feltz. She's a registered nurse and manager for the Arizona Fetal Care Network, which is part of Arizona Mother-Baby. So she kind of covers the baby side of things. And then we have Stacy Woods, who is a nurse midwife and lactation consultant, as well as a perinatal program specialist for Arizona Mother-Baby. Thank you both so much for being here.
Thanks. We're excited to be here.
Wonderful. So before we kind of get into exactly what Mother-Baby is, I want to kind of go through some basics and let people get signed on. And I also want to flag that we are, of course, taking questions live. So put your questions in the comments, and we'll be sure to answer them as we can and as we have time. So please feel free, load us up with questions. So let's just go through some of the basics. So if I'm the mom in the Valley and I'm either planning to have a baby or I'm newly found out I'm expecting, how do I approach you guys in this program?
Well, it's really easy. We have a phone number that's 602-933-BABY, and anyone, whether you're an obstetrician or a patient or an expecting mom or even a grandmother, you can reach out to us and we're happy to answer any questions that you have. A lot of people find out they're pregnant and then quickly need to know, when do I need to get an appointment? What kind of doctor should I see? Maybe I want a midwife. What is the difference between the different kinds of providers out there? And we can really help you navigate that system because it can be a little bit confusing out there where you want to start. So that's what we're there to help with.
Very good. And Jessica, so for your end, so say I'm pregnant and I find out, my baby has a diagnosis before the pregnancy happens. How do I go about kind of finding the right resources there?
Absolutely. So my program was established to help moms that they find out that their baby has some sort of diagnosis. And so we're here to help be a resource for them and connect them with the resources that their baby may need, both during the pregnancy and after the pregnancy. And so we also help to build a team and to create a team for them to not only support them in working with the OB, but also to support them in the delivery and thereafter. And so, again, that's where my program they connect with me, and then I can help them not only with the resources with the physicians, but also connecting them with the community resources they may need.
Very good. So here's another question. We kind of covered it, but I want to just get a little bit more detail. So what are some of the challenges that expectant mothers face? You said that there's a lot of stuff out there. What are some of these challenges you're seeing people come to you with?
So there's a lot of marketing directed towards pregnant women and new moms, and I know firsthand how difficult it is to try to figure out what information is evidence-based. Should I eat dates? Should I? Do cabbage leaves really work on my breast? So there are a lot of different bits of information out there that can be really confusing for new moms. And then you have family pressures and advice and friends, and there's so much to navigate. And we're really there to help direct you or patients to the best resources that are out there for any kind of question, really full spectrum questions about pregnancy.
You bring up a great point there. You say navigate. I think what a great benefit of this program is it's kind of a concierge type style model. And Jessica with Arizona Fetal Care, which is a part of Arizona Mother-Baby, you've been doing this concierge kind of service for a while. Absolutely. Can you kind of go into that a little bit?
I think the first step is really talking with the moms and talking with the families and see what their needs are. where is their understanding and their level of understanding on their baby's diagnosis? What resources do they need? What do they find are going to be most helpful to them? We also don't want to overwhelm them. So I think that part of that is really just assessing the needs of the family, seeing what they need, and then helping them to navigate that and to set up those resources. And whether it be connecting with mother-baby care because they have concerns or issues with their pregnancy, or is it connecting them with the subspecialist here at Phoenix Children's, or wherever they're planning on delivering at. And so we want to connect them not only with the hospital, but again, feeling that they're not alone in this and feeling that they have a resource to always call back on. And so that's the biggest piece, is when they're coming here to meet with our subspecialist, they'll meet with me personally too. So then they have a face to a name. They know who to call. I give them my cell phone number. So if it's evening times or something of that sort, and they're like, we forgot to ask this, or this is what's going on, I don't know what to do, then we're there personally to help navigate them. And I know, Stacy, those are similar practices that you have in your program.
Yeah, we're really there. Sometimes people just need to ask a quick question about something. I just want to know, where can I have a water birth? I just want to know, is that safe? Or where can I get skin to skin after delivery? Sometimes it's something quick like that, and other times it's a really complex case that we're working with a family together to make sure that the baby and the mom are both cared for, and that they know that we're communicating regularly and actually deeply caring for these women behind the scenes, and genuinely care about the outcomes for these families. And we get so excited when there's a delivery about to happen. And
absolutely.
Yeah, so it's very fun for us when we get to meet new people and new families.
And I think a big piece of that too, in that concierge portion, is what if you're out of the city? What if you have to change your delivery plans based on, say, your baby's diagnosis? That we're able to help them and facilitate that change, helping them to get connected to the resources that may be closer to the hospital they're planning on delivering at, maybe a place to stay, Ronald McDonald House, working with them, connecting them with other community resources that they may need, connecting them with a new OB, or getting them established with the new hospital. And so I think that that's also something that concierge, or that we can walk them through that change, because everything as they expected, I'm going to deliver at the hospital close to my house, or I'm going to deliver, right down the street, or that, where I delivered my other child, and that doesn't happen. And so we're here to help support them in that.
Yeah.
Very good.
But it could also be something very, very tiny. Sometimes conditions don't present themselves until the end of pregnancy. For instance, it might not be a high-risk pregnancy, and then all of a sudden they're presented with, oh, I'm post-dates, or my doctor wants to use such and such medication to induce my labor, and I have questions about that and concerns. So we don't really give real medical advice, but we don't have your full background of records and history and all of that. But we can direct you to some good evidence-based resources and talk you through some of the options that you might have.
Very good, very good. So you just kind of hit on this for a second, but I want to ask you both. I'll start with you, Stacy. What exactly is a high-risk pregnancy? Can you kind of go through what that means? I know it's a scary term, but yes. If you
it is.
Explain.
It is a scary term that nobody really wants. It's kind of like being advanced maternal age, which I am. But high risk is not, no one wants to be labeled with this label. And pregnancy in and of itself is a risky experience. But a high-risk pregnancy typically refers to a pregnancy where either the mom has a condition, like a seizure disorder, or perhaps she was born with a cardiac defect herself, or maybe is on some really strong medications for some disorder that she has, or an autoimmune issue. And then there is some stuff that goes on with the pregnancy that we find, like the placenta maybe has an issue, or the amniotic fluid, or maybe the baby itself makes the pregnancy high risk. And that's when we get Jessica involved for sure, because we want moms to know before the baby's even here, we want them to connect with Jessica so that they have a plan, and that right after birth, it's not a big shock with a bunch of information overflowing on this new mom when it's already a big experience, that they know what to expect. They've met their subspecialists already. They've connected with the neurologist, the pediatric neurologist, or GI person, and it's really just, we carry them right through the pregnancy and right into Jessica's arms with all the PCH resources.
Absolutely.
So.
And then here at PCH, but not only just here, but we're working with their delivery hospital. So it's making sure that that team is ready and waiting and available and to take care of that baby and knows when the baby's coming. And so then it's able to be supported of the mom, but also of the baby, and that those resources are ready and waiting for them. But also even afterwards. So after the baby gets discharged from the hospital, what do they need to do next? Who do they need to contact next? And so making sure that they can get connected with that subspecialist and with whatever resources that they need to.
So you're not just in shock. Like, you have the baby and you get this diagnosis and you're like, where do I go? What do I do? You already have your plan. Like, you've already talked to one of these lovely ladies and you know kind of where you're going to connect the dots next. So I think that's just awesome.
That's ideal. And then every once in a while, sometimes your baby's born and you had no idea you were going to have issues, which is kind of what happened in my case. And then Jessica, I actually used the service. And
you called 933 baby.
Yes.
I called Jessica and I said, I need this kind of doctor and that and that. And I just felt supported. And I think that that's what's missing. And in our healthcare system, I think we all recognize that every time you go to the doctor.
I think that brings us now to why this program is so unique. I want you kind of both in your own words to just explain. I think hopefully we have all of our viewers on now at this point to explain exactly what Arizona Mother Baby